Arjun, after I finished my clinical training and I started to learn the methods of public health, I started to realize that research in public health could not just impact individual patients, but impact whole populations. And when I started to have my science changing policies, that's really when I kind of caught the bug and I became so interested in the public health field. Sarah, I would say, go to your mentors, go to others, talk to people, because your self-doubts can be woven into incredible skill sets. Pursue those skill sets, and don't let your self-doubts get in the way of what you want to pursue. We all have had them. Miriam, I loved the fact that I could see individual patients one at a time and reflect and improve their own individual health, and that when we use the tools of public health, we could do that for millions of people at a time. That and the commitment to equity, which also was really important to me, has been really important to me, and so much of what we do in public health echoes that strong, strong commitment. When I was a little girl, I had a female pediatrician, and I never really realized that that was a thing that women could do. And so she was sort of my first inspiring character that maybe this was something that I could also do. Jackie, I still go to a lot of people for advice and feedback. Some of the deepest inspiration that I get is not from big public figures that one might expect, but really from my patients, things that my patients have taught me, and then really back to wise people who have helped me throughout my career. And generally when I'm at a crossroads, I talk to a lot of people, and I remain in touch with a lot of people. So I will call people from college, I'll call people from medical school and say, this one's a tough situation. How would you navigate this? So there are many people I continue to reach out to, and I would encourage everyone to keep those bridges, because that network will be invaluable to you in the years ahead. Hannah, this is such an important question. First, we need to open the doors and to make sure that there are plentiful opportunities for girls and women to step into the field. And then second of all, we need to make sure that women and girls are not intimidated to come forward. I can tell you many, many times in my career where I was like, oh my goodness, I'm not going to step into that, or I'm not going to be on that podium, or look at that audience. But if you let those intimidate you, then you never lean in. And I have actually told my mentees that the most important thing you need to do when you're intimidated is blow it out of the park and just make sure you give the best talk ever, and be prepared, and not be intimidated. Get in the door. Ria, there have been a lot. I know everybody wants me to say being nominated as the director of the CDC, and boy, has that been incredible. But every step has been totally cool. Medical school graduation, joining the faculty, my first research grant, becoming a professor, becoming the chief of my division, but then also saving a patient's life. All of those have been so meaningful, and all of them led to other things. So yes, it has just been incredible to be the director of the CDC, but every step of the way has been an incredible ride.